Welcome to another episode of Tuesday Talk. My name is Takuzwa Msakasa and I'm your host. In this show, we'll be discussing, our discussion will be centered around poor service delivery, cholera outbreak, and the rain season. Joining us on this segment, we have Honorable Member from Budiriro South constituency, Honorable Darlington Chigumbu. Welcome, Honorable.
Thank you so much, Taku, for inviting me to the show.
So recently we have been seeing the Ministry of Health has been updating the public about cholera cases, the number of patients, the people that have caught the cholera, and the number of deaths. And it has been declared a state of emergency. Can you tell us about the state of cholera in your constituency?
Okay, thank you so much for such a wonderful and a good program, which has come at the right time. As you know, Budiriro is one of the hotspots for cholera, and currently we are happy that this current pandemic has not affected us as much as we expected. But as a community, we are always vigilant. We are always encouraging our people to always remain vigilant because we are a hotspot. So I've tried to get the statistics, but I couldn't get the actual statistics. But I spoke to one of the senior health official in my community. Then she said that so far we have recorded a number of cases of people with running stomach diseases, and it's not yet they are not yet classified as cholera cases. Only I think 2 weeks ago, that's when we had an incident whereby somebody was declared to have died due to cholera. So it's one incident that I actually know of a person who died because of cholera. But I think at the moment we are not yet that bad, in a bad situation as before.
Okay, thank you, Honorable. So we know that issues to do with service delivery are issues in my councillors.
Yes.
Right, and I know you, Honorable, very well, that you work well hand in hand with your councillors. Can you tell us about the state of service delivery in your constituency?
Okay. Budiriro South is one of the most affected areas as far as service delivery is concerned. We are not getting the adequate service delivery that we must be getting as a community. And at one point, I had to actually approach the district office, council district office, to try and engage them and say, look, we have got serious cases which needed attention. And they promised me that they were going to attend to those cases. We've also liaised with the councillors. They are doing their best. They are trying to do their best to make sure that the service delivery. But the challenge that we are having at the moment is that when you engage the council, for instance, you have sewer based, you have dam sites, they'll tell you that we don't have capacity to deal with the problems. So that's the problem that we are having at the moment. And I'm happy that I think last week we saw some, dump trucks coming to clear my dump sites in our constituents. To me, it's a good thing, but as a community leader, you need a sustainable solution to the problems that you're facing. So I don't think that having someone coming to remove dump sites once in a blue moon is something that you can really applaud. But yes, it's fine. We are happy that the dump sites have been cleared. But if you check now, you can start to see they are already piling up. So as a leader of the community, I think we must find sustainable solutions. We must find solutions which will allow us to deal with these problems once and for all.
Okay, you mentioned that we mustn't applaud to these once-off, the government making once-off plans to carry out these cleaning measures in your community. Would you mind sharing if you have maybe a permanent solution for a constituency in terms of garbage disposal?
Okay, like I've said, I've told people in my constituency that I don't like to complain a lot. I like to find solutions. So after I discovered that, this problem of refuse not being collected and some other challenges which are causing a lot of insanity in the constituents, I decided that we start by acquiring our own refuse truck. It's an ambitious project that we want to implement, but I feel that if we are to have our own refuse truck as a community, it's going to help us to deal decisively with the issue of refuse collection. So I have, it's something that I want to do with the community. You see, when you are dealing with these issues of hygiene, you have to involve the people who are supposed to benefit from whatever initiatives to make sure that the hygiene is what is maintained in a community. So I had to engage with the community members to say, no, look, guys, we have had this problem of refuse not being collected. What should we do as a community? And then we did our calculations and discovered that it's going to be easy for us to get our own refuse truck, and we are working towards acquiring our own refuse truck. And I'm hopeful that by May or June, the refuse truck must be in Budiriro, and it should be starting to sort of address the waste management challenges that we are having.
Okay, so poor sanitation and clean water and sewage have been known as the key spark plugs to the cholera pandemic. And what is the major cause of this pandemic in your area?
Okay, what I've discovered, I think, is that there's a lot of politicking when it comes to the issues of service delivery. I feel, and I'm really, appealing to even those in higher offices to say, when we are dealing with issues that affect the people that we purport to be leading, we mustn't politicize those issues. Because, for instance, if we are to have a serious outbreak of cholera in Budiriro South, do you think it's going to be moving around asking, do you support ZANU-PF, do you support CCC? No, it's going to affect everyone. So the major problem is that the issues of service delivery have been highly politicized, which is not even necessary. So we need to depoliticize these issues, and we need to understand that when we offer service delivery, we are not benefiting few people from a certain political party. We are benefiting everyone, every member of the society. So the first thing that we must do is to depoliticize the issues to do with service delivery. The other thing is there's too much corruption. We must be able to deal with corruption. For instance, in Budiriro, we've had instances whereby people were given land in places which are not supposed to be, accommodating people. I think you heard what happened recently in Budiriro South, whereby a lot of people were affected by floods. Those people were placed directly in a wetland. So then you'd ask yourself, who authorized that for those people to build in such an area? So everything points to corruption. So we must also deal with corruption. I think if you check the report from WHO, it actually points that cholera is serious when we say we want to deal with corruption. We must be serious when we say we want to deal with land barons. Such that, because, for instance, in Budiriro, we've had, residential areas which are not paying any rates to the council, but they are actually benefiting from those who are paying rents to the council. The council cannot account for those people, but they are staying. They are staying there. They are enjoying the services, but they are not being they are not being built. So we have to deal with corruption. I think it's another solution to these problems. Yeah.
Okay. To those who are just joining us, I am with Honorable Darlington Chigumbu from Budiriro South constituency, and we are talking about poor service delivery, cholera outbreaks, and the rain season, and what's the way forward, what's next. Back to you, Honorable. So we have lately seen that cholera has been recurring over and over again. Like you mentioned in the WHO report, that cholera is mostly affecting urban areas. Why do you think Budiriro South keeps on being the hotspot?
Yeah, I think the major reason is that as a constituency, I think we are located at it's sort of a low-lying area. So because of the way that we treat our sewer and stuff, we are at the end. So it's easy for us to have water which is contaminated. So and you find out that most of the people in Budiriro, they're not receiving water, so they've resorted to either drilling boreholes or shallow wells. And I think if you have checked the report which came last week but one, they were saying most of these water sources, they are contaminated. And like it's an urban area that has got people of low income, so they are not going to be able to have those frequent water like sort of testing their water so frequently, because they don't have the money. So they will be only utilizing the water which they have. And this is the major reason why we end up having such diseases, cholera, affecting people in Budiriro South. So I think if people are to get potable water from council, and if the issues to do, like what we've been discussing, to deal with refuse collection, issues to do with fixing best sewer pipes, is going to help us a lot as a community. And I also think there is also less education, because if you come to Budiriro, it seems like people are not as concerned as they are with cholera as they were with COVID. So it means people are not like there's no information drive to make sure that people are aware. So I would also want maybe the government agencies and the relevant authorities to also focus more on educating people in terms of vaccines, which can actually help us as a community. There are a lot of vaccines to help us deal with cholera pandemic, but I think people are reluctant to take those, and there's no much information about them. So I think if those issues can be addressed, it's going to help us a lot.
Okay, Honorable, I have noted that you mentioned about access to clean water being contaminated. If the councils are to make a plan, but not now, what do you have as in store for your constituency, like an immediate plan for your constituency to have access to clean water? Something like that.
Okay, so currently, you see, the only possible solution that I can implement, or we can implement as a standalone community, is to sort of do bores. And then if we do bores, we put tanks, and then we monitor the water which is in each and every tank to make sure that if we are to apply chemicals and stuff. But like I said, I don't think it's a sustainable solution. So we want the government to expedite the issue of making sure that the Konji Dam is complete, so that we increase the capacity. Because if you check, Budiriro is one of the fastest growing suburbs in Harare. So the capacity, the number of people who stay in Budiriro, it has increased sharply in the past 5 years. So there must be then the drive to increase the capacity of whatever infrastructure that we have in the society. So the only solution that we can do as a community is maybe to drill bores. But like I said, I don't think it's a sustainable solution, because at the end of the day, we also need to treat that bore water as well, because it's definitely going to be contaminated.
Okay. Do you think as a nation, as Zimbabwe, we have the capacity, the resources, and the political will to maybe curb this outbreak?
Well, I think The capacity we have, I think the capacity we have as a country, I think we are blessed with a lot of natural resources. We are a rich country. So for me to say we don't have the capacity, I would say no, we have the capacity. But what I know for a fact that we don't have is the political will. Like I've said, there is too much politics when it comes to these issues of service delivery. So we must now generate that political will to say, as a nation, this country belongs to us. It doesn't matter which party or your political orientation. We must make sure that we work together to make sure that we improve the lives of those whom we are leading. So I think what we need now is the political will to say, look, guys, we are not going to politicize these issues of service delivery. Let us make sure that as the leaders, we thrive with all the power and energy that we have to make sure that our people are well looked after. So I think when it comes to capacity, we do have the capacity. What we need to do now is to work on the issue of a political will.
Honorable, I noted you mentioned about visiting the clinic, talking to the nurse in charge and talking to the patients. You have had first hand-in-hand encounters with the patients that have this cholera, that were affected by this cholera. Have any of the patients mentioned anything about not being able to access vaccines or in any nearby clinics or hospital, maybe because of the rains or because of the poor service roads and everything?
Yeah, not specifically like that, but the issues that these people will be telling you is like it's difficult for them to access when you are affected. It's difficult for you to access or to get access to support services. For instance, if someone is affected by cholera, it's not only that particular person who is affected, but the entire family is going to be affected, because there will be a lot of so that support service is not there. That's the major problem. And then is per clinic. If you get per clinic, I was shocked. Even the paracetamol, there were no medicines at this particular clinic, which is also worrisome, because you'd want to have a situation whereby your health centers, they are well equipped and they are resourced in terms of medicines, but they were not, even syringes, they were not there. So you become concerned now, if you are to have such an outbreak, how then are we going to deal and handle such cases?
Okay, unfortunately, we have run out of time. This was an interesting conversation. Thank you, Honorable, for coming through.
I thank you too for inviting me to the program.
From your host to the crew behind the scenes, have a great day.